Hey there, parents and soon-to-be parents. Welcome back to Baby Feeding USA. If you're brand new here, hi, I'm your name, and we talk all about baby feeding tips, schedules, and real-life advice to make your parenting journey just a little easier. So today, we're talking about something every new parent worries about, baby feeding schedules during that very first month. Trust me, I've been there. It's 2 a.m., the baby's crying, you're tired and wondering, is this normal? Should I feed them again already? Let's break it all down. Section 1. How often should newborns eat? On-screen title. How often should newborns eat? Okay, so newborns, especially in the first month, have tiny tummies. We're talking like the size of a marble at birth. Because of that, they need to eat a lot, usually every 2 to 3 hours, even at night. That means you're looking at about 8 to 12 feedings in 24 hours. If you're breastfeeding, feeds might be shorter at first but more frequent. If you're formula feeding, expect about 1.5 to 3 ounces per feed. Just remember, it's not about the clock. It's about your baby's cues. Section 2. Watch for hunger cues, on-screen title. Watch for baby's hunger cues. So how do you know when to feed your baby? They won't exactly say, hey, I'm hungry, but they will give signs. Look for these hunger cues. Rooting or turning their head towards your chest, sucking on their hands or fingers, lip smacking, becoming fussy or restless. Quick insert. Visual of a baby rooting and sucking their fist. If they're crying, that's actually a late hunger sign, so try to catch those earlier cues when you can. Section 3. Sample feeding schedule, on-screen title. Sample feeding schedule for the first month. Now remember, every baby is different, but here's a rough example of a newborn feeding schedule during those early weeks. Spiral calendar sample day. 6 a.m. Feed 8:30 a.m. Feed 11 a.m. Feed 1:30 p.m. Feed 4 p.m. Feed 6:30 p.m. Feed 9 p.m. Feed 12 a.m. Feed 3 a.m. Feed. Yep, it's a lot. But over time, feedings space out, and it gets easier. Promise. Section 4. Breastfed versus formula-fed schedules, on-screen title. Breastfeeding versus formula feeding. Is there a difference? Good question. Yes, a bit. For breastfed babies, feedings are often more frequent because breast milk digests faster, usually every 2 to 2.5 hours. For formula-fed babies, you might go closer to 3 to 4 hours between feeds, but still aim for 8 to 10 feedings in those early days. Whichever way you feed, it's all about following your baby's lead and making sure they're gaining weight and having enough wet diapers. Section 5. How to know baby is getting enough, on-screen title. Is my baby eating enough? This is probably the #1 question I hear, and it's totally normal. Here are some signs your baby is getting enough. Checkmark they're having 6+ wet diapers a day. Checkmark gaining weight steadily. Checkmark seems satisfied after feeds. Checkmark sleep well between feeds. But if you're ever unsure, call your pediatrician. Seriously, no question is too small. Section 6. Quick tips for feeding success, on-screen title. Quick tips for feeding success. Alright, a few quick tips to keep you sane during this first month. Baby bottle feed on demand. Not on a strict schedule. Baby bottle keep a feeding log for the first week. It helps track patterns. Baby bottle burp your baby after each feed. Baby bottle try skin to skin to encourage latching. Baby bottle, and most of all, give yourself grace. You're learning together. Thanks so much for watching. I hope this helped you feel a little more confident about those first month feedings. If you found this helpful, please give it a thumbs up, subscribe to Baby Feeding USA, and hit that bell so you never miss a new video. Got questions or want to share your baby's feeding schedule? Drop it in the comments. We'd love to hear from you. Subscribe, like, comment, follow us at Baby Feeding USA. Disclaimer. Pushpin. This video is for educational purposes only and does not replace professional medical advice. Always consult your pediatrician for personalized care and recommendations for your baby.